A 17-year-old boy dies suddenly while playing a basketball for his high school team. His heart is examined at autopsy. According to the image, which of the following is the most likely cause of this person's death? So if we look at the image, we can see that the heart undergoes hypertrophy. The wall becomes very thick. It is a concentric type, okay, in which the lumen becomes small, but the heart border, okay, is still at the normal position. It doesn't go dilation, okay. So if we see, there is two type of hypertrophies. Number one, there is a symmetrical hypertrophy, in which only the valve covering the ventricle, either it may be left ventricle only, or it may be right ventricle hypertrophy, or both valve commonly, okay, in genetical abnormalities, and the both valve become thick. But in case of some systemic disorders, for example systemic hypertension, the pressure to the left ventricle increases, and due to which only the left ventricle undergo hypertrophy. Either in case of cor pulmonale, the pressure exert more on the right ventricle, so that the right ventricle goes hypertrophy. But in case of some genetical abnormalities in some idiopathic conditions, the both ventricle become hypertrophy. So it is called a symmetrical hypertrophy, and it is not so dangerous. We can give medication for this, and we can cure easily. But in case of asymmetrical hypertrophy, there is a sudden chance of death, because you know, this is the septum and here is aorta into the left ventricle, okay, and there is a way outflow tract from the left ventricle to the aorta. But in asymmetrical hypertrophy, what happens, the septum undergoes in the process of hypertrophy. See what it do, it become hypertrophic. This is called as asymmetrical hypertrophy, only one side, and it is an obstruction to the outflow tract. So the blood, it have to do like this, then go like this. So there is a chance during the contraction this hypertrophied area further come this side, okay, further cause the obstruction of the outflow tract. So the outflow or the cardiac output become decrease in this patient. So this is a common cause for the athletes, okay, or for the patients having the this abnormality, that they undergo sudden syncope and sudden lowering of the cardiac output, which leads to sudden cardiac death of the patient. So in this condition, we can treat the patient with some sort of beta blockers, because in this condition, okay, we will give the patient some medication which inhibit the contractility. So the contractility become not so prominent, so there is less contractility, so it contract less, it come into the pathway less. So there is we can say there is a enough cardiac output that is required for the patient's metabolism. So in that condition we can save the patient. But in this condition, if we for example, these two are different, okay, they have different treatments. This one is more severe and it leads to more death of the patient. So let's see the what are the causes of the leading to hypertrophy. So enteroviral infections, it is not a common cause for the hypertrophy, okay. Immune mediated destruction of cardiomyocyte, definitely if there is immune mediated destruction, so there will be leads to cardiomyocytes, it doesn't leads to hypertrophy. And mutation in the sarcomere gene, such as myosin binding protein CS, mutation in gene that is myosin binding protein leads to the hypertrophy of the cardiomyocytes. So it is genetical abnormality which leads to the cardiomyocyte hypertrophy. Thank you.